Hello, and thank you for being on time for your session with the Beverly Hills Shrink. Today I'm going to talk about ADHD, or ADD. It's not alphabet soup, it's a mishmash because of political infighting by the people who like to change titles and names and codes and say they discovered something new that everybody already knew about. It is real. It affects the life of millions of people. It's overdiagnosed and underdiagnosed. It's overtreated and undertreated. Now, how can that make sense? I'll try to make some sense of it for you tonight. ADHD is a difference in attention, not a disorder in my opinion, because I'm an expert on it and I have it really, really bad ADHD. And I've learned that it's a disorder if you don't master it. If you master it, it's a difference that gives you an edge in many areas of your life. Technically, nowadays, there's ADHD with subtypes: inattentive, mostly girls, hyperactive, and impulsive, and a combination of all of them. The title isn't as important as accuracy in diagnosis. ADHD brains are different than other brains. They have a vast RAM capacity, with most of their memory running around in this large random access memory, and it's zooming around and they're distracting themselves and they're checking things and they forget what they said or did because it zooms by and they, oh yeah, and and what? Yeah. What proper treatment does is help slow it down, and instead of the brain controlling randomly what happens, the person learns to control their thoughts and their decisions and take time to be able to ponder and reason. It diminishes impulsivity. Now, the interesting thing about diagnosis, there's many factors. Certainly it's heritable. It's 80% inherited. There's 7 different genes involved in it. So if you do the numbers there, there's a very large number of combinations of genes that determine what the presentation is in any given individual. I've been to many, many meetings with some very smart doctors who know all the technical issues of ADHD. They know the chemistry, they know the neuroanatomy, they know the symptoms. Some of them have ADHD and some of them don't. The ones who don't have ADHD tend to use a lot of measures, a lot of charts and checklists and questionnaires, and they go by tight criteria. If you have 1 from column A and 2 from column B and 3 from column E or something like that, you've got it. But if you're short 1 item somewhere in that miasma of questions, you can't have it. It's either or. It's not the way it works. For people such as myself and many of my colleagues who have ADHD, we can intuit it. We know we're dealing with somebody with ADHD. It doesn't take interrogation, just 10 or 15 questions, and you know what you've got. Now, how can I say that? Let's take another example. There's men and there's women. Not political here. There's men and there's women. There are male gynecologists. When a woman goes to a male gynecologist and complains of some cramps and pain around her uterus or ovaries, the male gynecologist knows the anatomy, physiology, biochemistry. He knows where to palpate, to where to scan, but he doesn't understand exactly what's going on. If a woman says it to a female gynecologist, they say, oh yeah, I know what you're talking about. Let's take a look at it. Can't make it more clear than that. Everything isn't diagnosed by a checklist. Kids with undiagnosed ADHD, undiagnosed and untreated, have a 50% higher incidence of drug abuse than those who are treated. Once treated, that percentage drops to the average for the population. Isn't that interesting? Marijuana is the first drug of choice for untreated ADHD people. They say it makes them feel a little better, but it really makes everything worse. It's poison for them. It also causes a lot of false diagnoses of bipolar disorder. Keep that in mind. Treatment? Well, there's a lot of related symptoms and problems. There's often depression, anxiety, usually a sleep disorder called periodic limb movement disorder, carbohydrate cravings that often become bulimia that's misdiagnosed as bulimia when it's really a symptom of ADHD. I could go on and on, but this is supposed to last less than an hour. so I don't want to put you to sleep with all of the data. We can do it in another session if you like, or you can question in the Patreon and we'll try to answer there. The much derided drugs, Ritalin and Adderall, they're drugs, they're chemicals. Properly prescribed and supervised, they have dramatic benefits for the lives of many people. They have a paradoxical effect. They don't jazz somebody and get them high. They calm them and enable them to focus. The medicines, some work better for some people, others work better for other people. They should be used every day of the week, every day of the year for kids. There are a group of practitioners who believe in drug holidays. Don't take your ADHD medicine on weekends, holidays, and the like. That's very destructive. Let me explain. The kid on medication, usually young, doesn't really have insight, self-awareness. So 5 days of the week, they're good kids at school and they're stroked and rewarded and they get good grades and mom and dad are happy with the reports. And then on Saturday and Sunday, they're getting yelled at and spanked or punished because they're bouncing all over the place, misbehaving, not obeying. Well, gee whiz. If that child had epilepsy or diabetes or severe myopia and nearsightedness, I really doubt that the doctor would recommend don't give them their anti-seizure medicine, their insulin, their eyeglasses. Leads to very bad outcomes. This is a biological issue. In terms of how I was treated, how the time teller's been treated, or anybody else, I'm not going into that. That's a private matter. If somebody wants to tell you, they'll tell you, or they won't. Comorbidities. Comorbidities are other disorders or symptoms that occur together. It's like sneezing and coughing when you have a cold. They're comorbidities. Or getting bronchitis when you get a cold. Very common. They're comorbidities. Well, if you have ADHD, you're definitely going to have some mood issues. Moodiness. That's the train going by. Don't worry about it. It's not going to hit the house. Just let's continue. People with ADHD are generally very anxious because they can't find things. They can't keep track. They tend to be moody, particularly if their sleep disorder is not corrected. They tend towards depression. They're grossly overdiagnosed with bipolar disorder. Often that's precipitated by being given an SSRI, serotonin selective reuptake inhibitor. The ADHD brain doesn't want more serotonin, and it doesn't want dopamine blockade, the two things that SSRIs do. So no marijuana, no SSRIs, get them out of the picture. Then you can begin to examine the patient and make a clear diagnosis. There are some simple medicines that take on several of the symptoms together, such as depression, anxiety, and the ADHD. There's simple medicines for the periodic limb movement disorder. There won't be a quiz on this, so don't worry. You can just watch it over and over again until you've memorized it. Where shall I go next with this? I have treated numerous physicians, cardiologists, neurosurgeons, a couple of astrophysicists, a lot of moms and dads, and they all say how much better their life becomes when they're properly treated. Now let me tell you, there's 3 aspects of treatment, 3 parts to the treatment of ADHD. If you miss any one of them, you will get a less than desirable outcome. Number 1, education about the diagnosis. You have to understand what it is, how your brain works, how your processing works, why when you're a kid you say goofy things. Goofy to other people. They make sense to you, but other people don't get it. And they don't like when you blurt out the answer to a question without having done the work. They think you're cheating. Education about the diagnosis. Most of that can be self-acquired by reading mainstream material, not goofy stuff, weird diets and electric hats. But, we'll go on. Number 2, psychotherapy. Not psychoanalysis, not primal scream therapy, cognitive behavioral therapy. Doesn't really care about your feelings. It looks at the fact that we have many thought patterns, behavior patterns, emotional patterns that develop over time and unconsciously or subconsciously become the way we respond to things, address things. Often they're not very adaptive, but we keep doing them to our own dismay. We need to learn to remodel them consciously, selfishly, to work for us. The people who lose out on manipulating you, getting you to do things that they used to get you to do, will not be happy about it, but leave that to them. The third part is medication. In most cases, it's very simple. Medicine helps you pay attention better, be less distractible, stay on task. You need to know what medicine does not do. It doesn't make boring things interesting. It doesn't give you skills you don't have. It doesn't make you like things you don't like, and it doesn't turn jerks into nice people. They're still jerks, but medicine works. Properly chosen, properly administered, properly supervised. There are complex cases where stimulants are not appropriate. Those cases always should be dealt with by a skilled psychopharmacologist and expert in ADHD. That leads to my final point for the night. There's been a lot in the news, and it comes back every couple of years, about the overprescription of Ritalin and Adderall and the overdiagnosis of ADHD. Well, would you go to your nice, well-meaning, wonderful family doctor to have eye surgery? I don't think so. If you want a diagnosis of a neurologic, a neuropsychiatric issue, go to somebody who really knows what they're doing. Other people, not just family docs, gynecologists, orthopedists, eye doctors, are passing out stimulants to their patients, family, and friends to treat ADHD. No education, no cognitive behavioral therapy, lots of bad outcomes. These are well-meaning people for the most part. But then, I don't operate on eyes. I no longer deliver babies, which I did at one point. I do what I do, and I do it very well. So, if you want to look at a major contributing factor to the bad outcomes, overprescription, side effect problems, there you have it. So anyhow, our session is about done. I hope it has cleaned up a lot of misunderstanding of this very interesting diagnosis and its treatment. We will be doing regular Q&As over on my Patreon, so see the link in the description below and join. Also, please like, comment, and subscribe. And please be on time for your next session with the Beverly Hills Shrink.